Let's look at the histology. You see a spreading apart of the skin cells with edema fluid. You see inflammation, dilation of blood cells. There's probably thousands, if not tens of thousands, of changes happening in the skin and alterations of the barrier function. If you look at the genes affected, you can find tens of thousands of genes whose expression goes up or down. And one wonders, is this telling us something about the pathogenesis of the disease? I think these kinds of studies are not that helpful for telling us the cause. They tell us that when you have atopic dermatitis, you have tremendous perturbation, but what's causing those perturbations is much more difficult to get at. The genetics of atopic dermatitis have been studied, and there have been many studies of the genetics of atopic dermatitis, and in many of those studies you find filaggrin gene mutations. So filaggrin mutations are clearly a critical aspect of atopic dermatitis. In addition, many of the studies find genetic abnormalities in interleukin 13, interleukin 4, and the interleukin 4 receptor that, through which both interleukin 13 and interleukin 4 work. And then you have other studies that have found a host of other genes associated with the immune system that are related to the disease. Given that interleukin 13, interleukin 4, and the receptor that modulates the effects of those cytokines are genetically abnormal in patients with atopic dermatitis, these are key cytokine targets for the disease. So here we see interleukin 4 and interleukin 13 and how they bind to the interleukin 4 or 13 receptor, which shares a similar subunit, the interleukin 4 receptor alpha subunit. And so blocking interleukin 4, blocking interleukin 13, or blocking both by blocking the receptor would be key targets for approaches to improve atopic dermatitis. You could do that with antibodies, with biologics that would either bind the cytokine or block the receptor. And if you look, signal from the interleukin 4 and interleukin 13 receptors are mediated through the cell through JAK-STAT proteins. And so those intracellular targets, which might be addressable through small molecules, would be additional targets for improving atopic dermatitis.